Good afternoon, everyone. We're going to go ahead and get started. We're excited that you've joined us today for the BID Needham Community-Based Health Initiative Request for Proposals information session. My name is Jill Carter, and I'm the Manager of Community Benefits at BID Needham. And I would also like to take a minute to introduce you to a few other members who will be helping out today. We have Danelle Marable, who is the Director of Data and Evaluation for BI Leahy Health. And Alyssa Kentz is also joining us, and she will be helping to manage any questions that are submitted. This brings me to a few housekeeping items I want to cover before we get started. This session is being recorded and will be posted on the BID Needham Community Benefits website. And the slides from this presentation will also be sent out to everyone who is attending today's session. We encourage you to use the chat and Q&A functions. Please use the chat function if you have any technical difficulties and need any help with that. And please use the Q&A function for any questions that are specific to the RFP process. Please know that we will go through our presentation and leave time for the Q&A at the end. And in the event that you ask a question that we are unable to answer today, please know that we will get back to you as soon as we are able, and we will follow up with you. In addition, all questions that are asked will be posted to our website, along with the recording of this session. In today's session, we will start by providing a bit of background about the Community-Based Health Initiative, or CHI as we call it, and how the priority areas for the RFP were selected. The bulk of our time will then be spent providing details about the RFP, including who is eligible to apply, priority areas for funding, and grant amounts. We'll then review the RFP timeline before opening it up for Q&A. This is a high-level overview of some of the key information about the RFP, and we will go into more detail later in the presentation. Through this RFP, BID Needham will be distributing $516,000 over 3 years. We're funding programs in one priority area, mental health and substance use. And the funding opportunity is focused on one specific community in BID Needham's Community Benefits Service Area, and that is Dedham. And applications are due on October 13th. I want to start off by offering a little bit of background information. Anytime a hospital does a large capital expenditure, we have what is called a determination of need. A determination of need is required by the Massachusetts Department of Public Health, and it involves a process where the hospital is required to reinvest 5% of the cost of major capital expenditures back into the community to address prioritized needs. And in this case, the capital expenditures are related to the transition of ownership of the New England Baptist Hospital Ambulatory Surgery Center. BID Needham's Community Benefits Advisory Committee, or CBAC, has guided the CHI funding process by selecting health priorities and sub-priorities, as well as the strategies to address them from the 2022 Community Health Needs Assessment. And they also determined the funding allocation plan. We formed a separate allocation committee who will guide the awarding of funds, and this group must disclose any potential conflicts of interest, as does the Community Benefits Advisory Committee. We are very grateful to BID Needham's Community Benefits Advisory Committee, and I'm going to refer to them as the CBAC. They have guided this process, and we very much appreciate all their work. Members of the committee represent a number of different sectors and perspectives, and their input has been invaluable as we deeply appreciate their time and commitment. To give you some background related to the community engagement process, we conducted a transparent and robust process through our prioritized area. We relied on findings from our Community Health Needs Assessment in 2022, and we also engaged various community constituents through surveys, interviews, focus groups, and community listening sessions. After reviewing the information compiled from BID Needham's assessment, the CBAC approved the priority areas, sub-priority areas, and allocation percentages that you see on this slide. 40% of the CHI is going to housing affordability programs, including homelessness prevention and rapid rehousing programs. This is being done through a direct investment, so those funds have already been awarded. 60% of the CHI is going to mental health and substance use programs, and that is the focus of this RFP. The amount being directed to mental health and substance use programs is a total of $516,000 over a 3-year period, and up to 3 organizations may be awarded grants. The RFP is grounded in 5 core principles. The core principles are health and racial equity, impact, community, sustainability, and moving upstream. We are seeking applications that use a health and racial equity lens to dismantle systems of oppression and work towards the systematic, fair, and just treatment of people of all races, ethnicities, and communities, so that all people are able to achieve their full health and overall potential. And apologies if you hear the train in the background that is driving by. We are looking for impact in the priority cohorts and towns by employing the evidence-based and evidence-informed strategies listed in the RFP. We aim to build community cohesion and increase capacity by actively engaging with community residents and stakeholders. We want to see programs and initiatives sustained beyond the grant period by leveraging funding, creating partnerships, increasing organizational capacity, or by other means. And we want applications that address the fundamental causes of poor health and racial inequities by creating interventions that move further upstream. I want to dive a little bit more into what we mean by moving upstream. Through this RFP, we want to move beyond downstream and midstream interventions to solutions that are further upstream. Downstream interventions focus on addressing health outcomes and symptoms of disease, and they address instances of crisis. Midstream interventions often focus on individuals' social needs such as housing, transportation, and income. And upstream interventions take place at the policy and system level, affecting community-wide change and tackling institutional inequities. And we aim to fund programs that are more upstream and that are sustainable after the funding period ends. To help bring this to life, I have a few examples to share with you. The classic public health example of upstream versus downstream is from medical sociologist Irving Zola. And she describes a witness seeing a person caught in a river current. The witness saves the person only to jump back in and save more people who are caught in the river current. After rescuing several other people and reaching exhaustion, the person walks upstream to investigate why so many people have fallen into the river. The person wants to find and address the root cause of the problem. Another specific example at the program level is an eviction prevention program. A downstream initiative might look like helping people once the moving trucks have already come and someone is being evicted. To move a little bit upstream, that might look like helping people when they are facing an eviction court. Further upstream might be providing resources to those who are late on their rent and helping them before they go to eviction court. And lastly, moving even further upstream would be providing resources when someone first moves in to make sure they can pay their rent and they are stable. So we aren't only looking for policy solutions, but we do want you to think about how your program can be more upstream and further up the river to address the fundamental causes of poor health and racial inequities. Now let's get into some of the details of this RFP. To apply for this RFP, you must be an organization that is tax exempt, 501(c) status, or a public agency. And an organization that has a fiscal sponsor that is tax exempt is eligible to apply as well. In addition, applicants must be currently serving individuals connected to the focus community that we identified, which is Dedham, And Dedham was selected because it demonstrated the most needs from our community health needs assessment and because the ambulatory surgery center is in Dedham. The organization that is submitting the application must have a strong history of working in Dedham, and funds may only be used to service individuals and families that live, work, play, and/or learn in the Dedham community. And lastly, we want to see that an organization's leadership reflects the community it serves on many dimensions, including culture, ethnicity, race, and language. Our focus populations were selected based on a community health needs assessment and the input of the CBAC. And specifically, we want to see programs that serve youth, older adults, low resource populations, and/or racially, ethnically, and linguistically diverse populations. The CBAC has selected two strategic areas within the priority area of mental health and substance use. The first is mental health and substance use programs, and the second is around access to services and navigation. Applicants must select one or more of the listed strategies, and we've intentionally made these strategies broad to encourage your creativity. I'm now going to turn it over to Danelle, who will discuss the evaluation process.
Thank you. So I am Danelle Marable. I am the Director of Evaluation and Data for Beth Israel Lahey Health Community Benefits. So I'm happy to join here and be part of this process, and looking forward to working on this once the grantees have been selected. So we will be evaluating these programs or initiatives. What we hope to do as far as the evaluation requirements go is to co-create an evaluation and learning plan with the grantee or grantees. We really want to make sure we are measuring what matters. So what matters to you and what matters to us. So it's a very collaborative process. Depending on where you are in your evaluation and learning journey, we will offer capacity building, technical assistance, and workshops. That's on our budget to bring you up to collecting data and showing impact, and really using that learning and data to refine your program and to report impact. So these are kind of the broad strokes of what we'll be working on. Next slide, please. So overall, the purpose of the evaluation will be to answer these two big, broad questions, and we'll work with you to narrow this down. But it is, to what extent have the priority populations been reached, and to what extent have outcomes improved across the participant population, and/or what progress has been made toward policy change. So again, a piece of that upstream work as well. The grantee will be working with myself and an external evaluator. We are going to hire someone to help the grantees, especially around creating a learning and evaluation plan, and increasing the grantees' capacity to collect data and show impact, and again, learn from that data. In broad strokes, though, grantees can expect to collect and report on socio-demographic measures, implementation or service delivery measures, and outcome measures. So kind of a who, a what, and what's the impact we'll be collecting. Next slide, please. So we want the first 3 months of the grant period to be around planning. So planning the implementation and planning the evaluation. So you'll work with myself and the external evaluator to create a logic model or a theory of change. If you don't have one already, we want to understand where you are in your evaluation journey so we can figure out how much capacity do you need, what kind of technical assistance do you need in order so that you can fulfill that learning and evaluation plan. And then next slide. You'll go into your implementation plan starting in May for the rest of the 3-year period. So you will be regularly engaging with us, letting us know what's happening, reporting back to us. We are expecting semi-annual reports, and it might be a mixture of meetings, site visits, and actually written materials, and we'll figure that out during the planning process. Next slide, please. And then this is our logic model or theory of change that we've put together for this specific DON funding. So with that sub-priority of building capacity and increasing education on behavioral health to reduce stigma. And these are evidence-based strategies that we've listed here that we found. Again, we are funding evidence-based strategies in order to get to the funding outcome of increasing access to high-quality, culturally and linguistically appropriate mental health and substance use services. So this is what we're expecting from this funding. Maybe for 3 years, probably getting to maybe that intermediate effect, hopefully getting to that funding outcome, maybe not getting to that long-term effect because that's further down the line. But we are expecting to create something like this with you, a whole logic model or a theory of change within the first 3 months of funding. And
Thank you, Danielle.
Back to you, Jill.
Thank you. So we've included, oh, excuse me, sorry, went ahead of myself. Wanted to just go through the funding. We've outlined here what funds may or may not be used for. So funds can be used for programmatic expenses, which includes staff salaries, data collection and analysis, meetings, supplies, project-related travel, or other direct project-related expenses. Funds cannot be used to provide medical services, support clinical trials, construct or renovate facilities, or other capital expenses. Indirect expenses, which we often refer to as overhead, may not exceed 15% of your total budget. And we do recommend that you allocate 10% of your budget to the evaluation process that Danielle just described. And that can include things such as evaluation consultants, data collection and interpretation, sometimes software purchases to help facilitate that data collection, staff time used for data collection, and so forth. On this slide, we've included our scoring criteria that our allocation committee members will be using as they review applications. We really try hard to make sure that this criteria is aligned with the questions that we ask you on the application. I know there's a lot of criteria here. Please know that a copy of this is in the appendix to the RFP, which is also on our website. Wanted to just review the timeline. The Q&A period started in mid-August when the RFP was released, and it goes until September 15th. All questions and answers will be posted on our website by September 20th. Applications are due October 13th by 5 p.m. Eastern Time. And please note that applications must be submitted through our community benefits database, and directions to do that can be found again on our website and also in the RFP. Applicants will be notified by December 15th of the grant decisions, and the grant period will begin February 1st. This will mark the start of that 3-month planning process that Danielle referred to. And then finally, the grant period will end on January 31st, 2027. I also want to draw your attention to the reporting timeline. Danielle alluded to this. An annual report will be required each October, beginning the first full year of the grant, which is 2024. And an interim progress report will be due in May of each year, beginning in 2025. We will have templates for these reports, and we will give you more detail and guide you through the process as we get closer to those dates. And lastly, we just wanted to address some common questions that we have gotten through prior RFP processes through BILH. So I wanted to just start with a few of those before we open it up to you all for questions. So the first is, can an organization submit multiple applications? No, an organization can submit a maximum of 1 application as a lead organization. However, an organization can be listed as a partner in multiple applications. though you should consider your capacity to complete responsibilities as partners should multiple projects receive funding. And the second question, are nonprofits with a fiscal agent eligible to apply? Nonprofits with a fiscal agent, also known as a fiscal sponsor or fiduciary, are eligible to apply for funding. And lastly, who decides where to award the funds? So BID Needham has formed an allocation committee made up of individuals who have disclosed any real or perceived conflicts of interest, and they have told us that they will not be an applicant for this community-based health initiative funding. The allocation committee includes BID Needham staff, BID Needham Department of Community Benefits representatives, residents of Dedham, and local experts and representatives from Dedham. The committee is tasked with overseeing a transparent, public, and competitive process for awarding funds for local strategies that address the health priorities and strategic focus areas identified by the CPAC. And with that, wanted to open it up to see if anyone has any questions. I don't know, Alyssa, if you have gotten any through the Q&A.
Not yet, but it is open. So if you have anything, go ahead and type it in.
Give you all just a minute, a couple minutes to get your questions in. Okay, doesn't look like there's any questions. So if that's the case, if you have questions after the fact, they can be emailed to us and we will share them publicly. As I said, any questions will go onto our website as well as the slides in this recording. Thank you everyone for joining us today, and we hope you enjoy the rest of your day.